Okay, I'm Remi Adeseun. I'm a fellow of the Pharmaceutical Society of Nigeria. I'm here in my capacity as the country manager West Africa for Quintiles IMS.
The goals of healthcare are very simple. Of health, you want access, both physical access. Do I know where the next ENT surgeon is? My brother, who is a banker, called me one day. You are in the space. I have a very bad ear pain. I have a meeting in 4 hours. I need someone to see me now. It's in VI. I start to call all the people I know in Luth. Now, imagine that I need a hotel in VI. I just go to any of these various hotel apps and the tens and hundreds of hotels in VI will come up. The same thing we need for health. What are the facilities that are present in each location?
Healthcare information management is very critical. And actually, there's something called the building blocks of health systems. It's a WHO concept originally, but Nigeria has adopted it. It has about 8 building blocks. And to emphasize the importance of information, the healthcare information management systems is one of those 8 building blocks. The others are things like service delivery. You have things like stewardship and governance. You have things like health financing, human resources for health. All of these are tied together by technology. Healthcare information is what the world has moved into, where every patient has identifiable records that help the healthcare professional in determining the cost of treatment for it. In other places, that information is portable. What do I mean by that? The information can move with the patient wherever he's seeking care. So just the same way we have been liberated from the brick and mortar of financial institutions, you can now go anywhere in the country, access money in your account, which is domiciled in Lagos, while you are in Maiduguri. How did it happen? Technology.
So we can have all these things and you will see that it will create a platform model. When people are using your platform, that's where your revenue comes in. And that's the kind of things we should be looking at. Not what the problems are per se, but benchmarking. What is working well in other sectors that we can bring into healthcare?
The technology was not left as an option. So that's where government policy comes in. Government policy over time dictated that the banking system must be connected. We need to move towards that in Nigeria as well. Have an integrated healthcare exchange where every transaction that takes place within the health system, from the patient's journey to diagnosis, to prescription, to all the other things that go on, are captured. And each professional who has access to the patient has access to that information and can better manage the patients for better health outcomes.
So we talk about the DIC and the need for us to incorporate DIC. Data must be transformed into meaningful information, and it must be converted into actions that will benefit the things that we all live for in health. Longer life, and not just the absence of disease, but full physical, mental, and spiritual, and whatever else.
Through collaborations and identifying gaps in the system, where are the pains that the practitioners and the patients, the practitioners on the one hand and the users of the health system, where are the pains they're feeling the most? What are the gains you can create for them? So it's that ecosystem that we in Quintiles IMS are very interested in building. There are many young and dynamic app developers. We have the infrastructure, we have the global presence, and we have those connectivity things. But the peculiar requirements of Nigeria are best captured by those who have operated in that system.